I'm proud of the staff. Staff have measured up, especially in the early stages of COVID where we didn't quite understand it. We didn't know how effective the gear, was and whether it was going to protect us. There are a lot of health staff that have had bad outcomes with COVID. And so, that aside, our staff still went in and did what they were supposed to do. So I'm very proud. As a institution, the coordination with custody and the executive staff, they made it very easy to communicate. We've had ongoing meetings, sometimes 3 or 4 a day, easy, about COVID. Becomes exhausting, but that type of communication is necessary to respond. Again, we didn't have all the answers up front, so the pandemic developed as we went along. We learned a lot as it went along, and so just making sure we respond when we find like new measures that could be taken or something different that we could do, or all in an interest to change outcome and to treat patients. This is our infirmary. This area is usually extremely busy. Right now we're down for count, and so patients are back in their respective areas. And so, but normally this is busier than most ERs. If you come this way, this is our trauma room. We treat anything from hangnails all the way to full codes. And then as care is needed or escalated, we transfer patients out for care that can't be performed here. This is one of our exam rooms. Again, these areas are extremely busy. This is where providers come and see patients during the day. Our mid-level providers go out to the respective areas where patients live or are housed. And then as care is escalated, they come to the infirmary and see mostly physicians. This is the Wasatch Dental Clinic. It's one of 4 prison-wide. We currently have 13 dental staff, so we provide a full range of services for the inmates. The patients are brought in, and we have a nurse that is a presenter. And we present the patient, and then the physician over the network directs what we do or what exams we do, and they're able to get the information they need in real time and correspond with the patient. The x-rays are taken here. So when we're running a telemedicine clinic, right, and the surgeon needs an x-ray, we're able to perform the x-ray right here and then bring the patient back to the telemedicine room, and we have the x-ray visual right in front of us at the time of the visit. So it happens almost immediately. So right now we're assembling a team of people to go in and do some mass testing. It's one team of a few. We're going into D block right now, and they're going to go through the sections and test individuals. And so we spend a lot of time on tracing and testing, and also surveillance of individuals who might have symptoms of COVID. And when we find there might be possibility of an outbreak or an exposure, then we go ahead and decide which sections to test. That helps us prioritize our care and use it most effectively.